1. Team leaders making patient assignments require knowledge of each team member's skills and competence. This is. Choose the correct option to complete the sentence. A. Accurate. B. Inaccurate. C. Unrealistic. D. Realistic. The rationale is, assigning patient care. Team leaders making patient assignments need to have knowledge of each team member's skills and competence in order to make appropriate and effective patient assignments. This is a realistic requirement for effective team management in a healthcare setting. 2. An adult nurse is educating a student nurse, who asks about the difference between dementia and Alzheimer's disease. Choose the correct answer. A. They are the same thing with different names. B. Dementia is the overall illness and Alzheimer's is a type of dementia. C. They are two completely different illnesses. D. Alzheimer's is the overall illness and dementia is a type of Alzheimer's. Rationale is, dementia is a general term used to describe a decline in mental ability that is severe enough to interfere with daily life. It is a group of symptoms that can be caused by various conditions, including Alzheimer's disease, Parkinson's disease, Huntington's disease, and others. Alzheimer's disease is a specific type of dementia that accounts for 60 to 80% of all dementia cases. It is a progressive neurodegenerative disorder that affects memory, thinking, and behavior. Therefore, while Alzheimer's disease is a type of dementia, dementia is not the same as Alzheimer's disease. 3. Which of the following terms best describes the investigation process after drug error? A. Closed. B. Quick. C. Open. D. Slow. Rationale is, an open investigation means that it is transparent and thorough, with all the relevant parties involved in the process. This includes healthcare professionals, patients, and their families. The goal of an open investigation is to identify the root cause of the error and take steps to prevent it from happening again in the future. In contrast, a closed investigation suggests that the investigation has already been completed and the case has been closed, which may not be appropriate for drug errors as the focus should be on preventing future errors rather than simply closing the case. Quick and slow do not accurately describe the investigation process, as the speed of the investigation should depend on the complexity of the case and the thoroughness required to identify the root cause. 4. A nurse is about to feed a patient via their gastrostomy tube and notes that the area around the tube is reddened. Choose the correct answer. A. No action, administer the feed and document it in the notes. B. Put another dressing over the top of the tube. C. Clean the area and take a swab. D. Request a prescription for antibiotics. Reddening around a gastrostomy tube may indicate infection or skin irritation, which could be a sign of an underlying problem. It is important for the nurse to clean the area around the tube and take a swab to check for infection. Administering feed or putting another dressing over the top of the tube without addressing the underlying issue could exacerbate the problem. Requesting antibiotics may be necessary if the swab results indicate an infection. Therefore, option C is the correct answer. 5. The Health and Safety at Work (ETC) Act 1974 is intended to protect those at work as well as. Choose the correct option to A. The wider public. B. The employers. C. The organizations. D. The employees. Workplace Safety Protection. The Health and Safety at Work (ETC) Act 1974 is a UK law that is intended to protect the health, safety, and welfare of people at work, including employees, contractors, and members of the public who may be affected by work activities. Therefore, the correct option is A. The wider public. 6. A strong but safe painkiller is prescribed for child, although the drug is licensed for adults only. What must happen before the drug can be given? Choose the correct answer. A. The child parents must be given sufficient information for them to make a decision about the medication. B. An incident reporting form must be completed. C. Unlicensed medications are commonly used, so no further action is required. D. The prescriber must discuss with social services before the drug is given. Safe painkiller for children. It is important to provide the child's parents or legal guardians with sufficient information about the medication, including the potential benefits and risks, possible side effects, dosage, and any special instructions for use. The parents or guardians should also be informed that the medication is not licensed for use in children, and that its safety and effectiveness in this population may not be well established. Informed consent should be obtained before administering the medication to the child. The answer is B. 7. A patient is recovering following an abdominal hernia repair. What advice does an adult registered nurse give? Choose the correct answer. A. Remain on bed rest until your doctor advises otherwise, and avoid any lifting. B. Avoid doing sit-up exercises for at least 6 weeks. C. Avoid strenuous activities such as biking or weightlifting, and try to run each day. D. Try to walk each day, and avoid lifting anything that might make you strain. The correct advice an adult registered nurse would give to a patient recovering from an abdominal hernia repair is to try to walk each day, as this promotes circulation and can help prevent blood clots. However, the patient should avoid lifting anything that might make them strain or put pressure on the surgical site. Additionally, the patient should avoid strenuous activities such as biking or weightlifting until their doctor advises them that it is safe to resume these activities. Finally, the patient should also avoid doing sit-up exercises for at least 6 weeks to prevent straining the surgical site. The correct answer is D. 8. The friends and family test is a type of. Choose the correct option to complete the sentence. A. Quality measure. B. Value measure. C. Carer measure. D. Patient measure. Patient satisfaction measures. The friends and family test is a type of patient measure. It is a feedback tool that is used in healthcare settings to measure patients' satisfaction with the care they have received. Patients are asked to answer a simple question, such as, how likely are you to recommend this service to your friends and family? On a scale of 0 to 10, the results are used to improve the quality of care and to identify areas that need improvement. The answer is D. 9. A Band 6 nurse is teaching a new healthcare assistant how to clean and redress a wound. What does the nurse need to assess prior to help with learning? Choose the correct answer. A. Learning style. B. Instruction style. C. Teaching style. D. Feedback style. Wound care learning style. Before teaching the new healthcare assistant how to clean and redress a wound, the Band 6 nurse should assess the assistant's learning style. This will help the nurse to tailor the teaching approach to best suit the assistant's preferred way of learning, whether it is through visual aids, hands-on practice, or other methods. Understanding the assistant's learning style can also help the nurse to anticipate any potential difficulties and adjust the teaching accordingly. Therefore, the answer is A. 10. A patient in a nurse's care needs a blood transfusion urgently. The nurse's religion denounces this practice. What action does the nurse take? A. The nurse reflects on the factors involved and defer the decision until later. B. The nurse acknowledges that the intervention is an urgent patient need, but refuses to. C. The nurse declines to care for the patient and hopes that another nurse arrives. Agree based on religious beliefs. D. The nurse recognizes that this is a personal factor that could influence a decision and seeks help and advice. Religious beliefs and patient care. 10. A patient in a nurse's care needs a blood transfusion urgently. The nurse's religion denounces this practice. What action does the nurse take? A. The nurse reflects on the factors involved and defer the decision until later. B. The nurse acknowledges that the intervention is an urgent patient need, but refuses to. C. The nurse declines to care for the patient and hopes that another nurse arrives. Agree based on religious beliefs. D. The nurse recognizes that this is a personal factor that could influence a decision and seeks help and advice. D. The nurse recognizes that this is a personal factor that could influence a decision and seeks help and advice. As a healthcare professional, the nurse has a duty to prioritize the patient's well-being and provide necessary care. However, personal beliefs and values can sometimes conflict with professional obligations, creating a moral or ethical dilemma. In this scenario, the nurse's religious beliefs conflict with the urgent need for a blood transfusion. The nurse should recognize that this conflict is a personal factor that could influence their decision and seek help and advice. This could involve consulting with a supervisor, an ethics committee, or a chaplain to help navigate the situation and find a solution that balances the patient's needs with the nurse's beliefs. It is not appropriate for the nurse to delay the decision, refuse to provide the necessary care, or abandon the patient. 11. A nurse is asked to trial a new clinical product on the ward and asks for the research beforehand. How does the nurse review the literature? Choose the correct answer. A. By researching the company website. B. By reviewing the manufacturer's published findings. C. By undertaking a review of the question asked. D. By undertaking a research critique using a valid framework. When reviewing the literature for a new clinical product, it is important for the nurse to undertake a review of the question asked. This involves identifying the research question, defining the population, intervention, comparison and outcomes of interest PICO, and then conducting a search of relevant databases to find studies that answer the question. Once the studies have been identified, the nurse can then critically appraise the evidence using a valid framework to determine the strength of the evidence and the validity of the research findings. Simply researching the company website or reviewing the manufacturer's published findings may not provide a comprehensive and unbiased view of the clinical product, as these sources are often produced by the company and may be biased towards promoting the product. Undertaking a research critique using a valid framework is important in order to evaluate the quality of the evidence and make an informed decision about whether to trial the product on the ward. 12. Feedback given using the sandwich method is choose the correct option to complete the sentence. A. Constructive timely positive. B. Positive constructive positive. C. Positive timely positive. D. Positive positive constructive. Order confirmation received. The sandwich method of giving feedback involves beginning and ending the feedback with positive comments, with constructive criticism in the middle. So the correct options are positive constructive positive.